Is it possible to prevent getting dementia? Is it possible to cure dementia once you have it? Unfortunately, the answer to both of those is no. However, it is possible to reduce your risk of getting dementia, and it is possible to slow the progression of dementia after it's diagnosed. That's the objective of this video, to teach you some of the most common risk factors for getting dementia and ways that you can take a proactive approach to preventing it and maybe slowing down the progression if the diagnosis of dementia is being made. Now, for the purpose of this video, we're strictly focusing on Alzheimer's. It's the most common form of dementia. The second most common form is vascular dementia, and that really comes down to taking care of your cardiovascular disease. And then other than that, we have Lewy body formation and frontotemporal dementia and Parkinson's, and we're not going to be touching on those. We're just sticking with Alzheimer's in this video because it is the most common. Now, prevalence of Alzheimer's is on the rise in the USA, and it's expected to continue to rise. In fact, a new paper just this week in the journal Nature predicts that the number of Alzheimer's cases in the USA will double by the year 2060. Now, the obvious focus should be on the cognitive decline of the person diagnosed with Alzheimer's. However, there's much more to it than that. There's much more than just the person with the diagnosis. The caregiver is usually a family member, and many family members find themselves sacrificing their career or their personal life or leading to social isolation. And in fact, the ongoing stress of caregivers for people with Alzheimer's often leads to health problems for the caregiver, including anxiety and depression and things like that. But it's not just that, it's also the financial burden. The financial burden is quite heavy. The average financial burden for someone with Alzheimer's disease is between $40,000 to $80,000 a year, and that means the total financial burden can range anywhere from $200,000 to well over $1 million, with the average being somewhere between $350,000 and $400,000. Now, families typically have to cover about 70% of that total cost, with Medicare or long-term care picking up maybe the other 30%. So with all of that doom and gloom behind us, let's spend the rest of the time in this video looking at proactive steps that people can take to prevent Alzheimer's disease or slow down the progression once it's diagnosed. Now, the first thing we need to understand is that Alzheimer's is a complex neurodegenerative disorder influenced by genetics and lifestyle and environmental factors and diet. And in other words, it's a multifactorial or multivariate cause. And since it's a multivariate cause, taking a univariate approach is often going to be very limited in its success. Now, that sounds like a bunch of sort of word salad. So what does that mean in practical sense? So examples of a univariate model would be focusing on things like tau proteins and amyloid plaques, and for Parkinson's it would be alpha-synuclein, or neurotransmitter theory like acetylcholine. Now, these are one cause, one treatment approaches, as opposed to the multivariate model, which would look at different causes and different solutions for the same patient. So some examples would be exercise, nutrition, exposure to chemicals and pollutants, head trauma, sleep, cardiac arrhythmias. The univariate model has many studies looking at many different medications, and thus far, they've not been able to significantly alter the course of Alzheimer's or dementia. The multivariate model, however, is showing some promise. So stick around to the end of the video because I want to go over a study that took a personalized program to look at specific needs of individual patients. And the results are absolutely mind-blowing. But it's important to understand that this is a neurodegenerative condition. It is a degenerative condition. So these short-term improvements that you may see are unlikely to reverse the whole process of the entire disease, right? What's more likely to see a slow downward trajectory of the whole process. Now, it is possible to slow down that progression, and that highlights the importance that you really don't want to be the person that waits to be diagnosed with Alzheimer's. You want to be proactive now. So finally, keeping that in mind, let's take a look at some proactive steps that people can take to prevent the onset of Alzheimer's or to slow down the progression. And take note, I said proactive steps to take. I didn't say proactive steps that you can take, right? Because your needs are going to be different than my needs, and everybody's going to have different needs. Some of them may be highly applicable to you, and some of them may be not applicable to you at all. And that's the point of having a multivariate approach for individuals, right? So also keep in mind that this is not an exhaustive list. These are just things that through my own research, I've found to seem to have the most impact on preventing Alzheimer's or slowing down the progression of Alzheimer's. So without further ado, the first thing we want to look at is dietary interventions. And first on the list is the Mediterranean diet. So the Mediterranean diet is typically rich in fruits and vegetables and whole grains and fish and olive oil and reduced processed foods, right? And that has been shown to reduce the risk of Alzheimer's. A meta-analysis found that adherence to the Mediterranean diet was associated with a 31% reduction in Alzheimer's risk. Now, right away, I might have a caveat here because the study that we just talked about, and most studies that look at this type of thing, are observational studies. In other words, they just observe what people eat for a couple decades. But even that's not true because they don't really observe what they eat, right? It's based on recall. It's what the patient thinks they remember eating, which can be highly inaccurate, right? And it also doesn't establish a cause and effect relationship, right? Even if it was accurate, the people who tend to eat a Mediterranean diet probably read that it's more healthy for them, right? So if they read that that's more healthy, they probably read that exercise is also more healthy and that not smoking is healthy and that, better sleep and stress management is also healthy. So when you look at these observational studies, there's a lot of confounding factors that may be influencing it other than the diet. The best way to go is a randomized controlled trial where you randomly assign people to a diet. And it's going to be like, okay, you guys are going to eat this particular diet for the next 30 years, and you guys are going to eat the diet for the next 30 years. And, there's no way that you can do that. There's no way somebody's going to sign up to eating a particular diet for a study for 30 years. So randomized controlled trials aren't really possible for these long-term studies. So observational studies are the best we have. So that being said, the next topic is the ketogenic diet. Now, the ketogenic diet is typically very high in fat, very low in carbohydrates, which makes your body produce these things called ketone bodies. Now, the ketogenic diet has shown a lot of promise in preventing Alzheimer's or even improving the cognitive function of people with Alzheimer's. So this meta-analysis looked at the results from 10 different studies and found that patients with Alzheimer's disease, those people adhering to a ketogenic diet, significantly improved cognitive function as measured by the mini mental state examination, with a mean difference of 1.25 points. And then also the Alzheimer's Disease Assessment Scale Cognitive Subscale, or the ADAS-COG, with a mean difference of negative 3.43 points. Now, I know what you're saying. What the heck is an ADAS-COG test, and is negative 3.43 points even relevant? So let's put it in perspective. The major class of drug that's used for treating Alzheimer's are called acetylcholine esterase inhibitors. And when you take acetylcholine esterase inhibitors, the average reduction in the ADAS-COG test is between 2 and 4, depending on the study. So the fact that the ketogenic diet reduced it 3.43, that puts the ketogenic diet to be equivalent to the standard drug class of acetylcholine esterase inhibitors. So that's pretty good. Now, you also may be wondering, how the heck does a ketogenic diet even do that? Well, we don't have all the answers yet, but we know that ketone bodies reduce inflammation in the brain. But this initial study just published in 2025 on mouse brains indicates that ketones can actually break down and remove amyloid plaques from the brain, which is crazy. So then we move on to omega-3 fatty acids, which can be sort of part of the ketogenic diet, right? Because it's high in fat. But what the research is showing is we know that omega-3 fatty acids, particularly, you have EPA and DHA, particularly the DHA, has been shown to significantly affect the progression of Alzheimer's disease and the prevention of Alzheimer's disease. So this 2023 study, it was a meta-analysis, and they looked at 48 different studies involving over 100,000 people. And what they found was that the dietary intake of omega-3 fatty acids could lower the risk of all-cause dementia or cognitive decline by about 20%, especially the DHA intake. So now let's move on to lifestyle interventions. And the first and most obvious one is physical exercise. So regular physical activity, particularly aerobic exercise, has really been shown to reduce the progression of Alzheimer's and reduce the risk of getting Alzheimer's to begin with. So this particular study looked at 19 different studies on exercise and Alzheimer's and concluded again that the effect of exercise was equivalent to that of the standard acetylcholine esterase drug inhibitor class. Okay, so now let's move on to the next thing in the lifestyle interventions, being sleep, right? That's easy. Just go to sleep. Prevent Alzheimer's. Easy enough. However, poor sleep quality and sleep disorders like obstructive sleep apnea are definitely associated with an increased risk of getting Alzheimer's. So this meta-analysis reported that individuals with insomnia had a 42% increased risk of developing Alzheimer's, while self-reported sleep problems were associated with a 34% relative risk increase. And also sleep apnea has been shown to increase the risk by over 100%, which makes sense, right? If you have sleep apnea and you're not getting proper oxygenation in your blood, that means your brain isn't getting enough oxygen for like what, 6, 7, 8 hours a day? That's not going to be healthy for your brain, and the risk of that is significant for developing Alzheimer's. Okay, so the next thing on the list for lifestyle risk factors is hearing and vision impairments. And yes, you saw that correctly, you heard me correctly, or at least I hope you did, because if you didn't, that's probably not good for your brain. But the basic idea is hearing and vision impairments are linked with an increased risk of Alzheimer's. Now, you might say, well, that's an association again. You know, there's a lot of different things that could cause, let's say, visual problems like diabetic retinopathy could cause that. And maybe people who have diabetes are just more likely to get Alzheimer's, which they are. But we get past that association when you look at these studies that do actual hearing and vision corrections. So this study found that cataract surgery was associated with a decreased risk of Alzheimer's, and a systematic review of more than 100,000 people showed that if you correct hearing loss, there's a 19% reduction in the risk of Alzheimer's. So that's pretty much proof that it's not necessarily just the association, because if you fix the vision and you fix the hearing, there's a reduced risk of Alzheimer's, right? And again, you may be wondering, well, why is that? Well, it's the same thing as like cognitive exercises, where if you don't use it, you lose it type of thing. If you're looking out the window and everything's blurry, or you're hiking and everything's blurry, that means there's less detail entering your brain. So that means there's less input to the brain. Less input to the brain means less stimulation to the brain. And less stimulation to the brain is going to result in degeneration of the brain. So it's just a matter of, always keeping information coming into the brain. So moving on to the easy button aspect of things here, we have supplements. Now, vitamin D, I did a video on vitamin D recently, so you can go back and look at the importance of that. But vitamin D deficiency is really associated with an increased risk of dementia. And supplementation with vitamin D has been shown to have potential benefits in improving cognitive function and reducing Alzheimer's risk, particularly in individuals with a low baseline level. So this study found that vitamin D supplements was associated with a 17% reduced risk of Alzheimer's. But again, I'm going to say this again, like I said earlier, you have to do this on an individual basis, right? And I went over this in that vitamin D video. There's a lot of people who have gallbladder problems, so they're not absorbing the vitamin D. They can have kidney problems and liver problems, so they're not processing vitamin D properly. Maybe you take too much vitamin D and that's going to cause too much absorption of calcium. So you really have to make sure that you get your vitamin D levels tested before you just willy-nilly start taking a ton of vitamin D, right? And the same thing is applicable for the next category, which is B vitamins. A lack of B vitamins will result in a high level of homocysteine. Now, homocysteine is involved in what's called the methylation cycle. And we don't have the time in this video to go over everything about the methylation cycle, but basically, you need B vitamins to be converting homocysteine into methionine and glutathione and these different things in the methylation cycle. And if you're low in B vitamins, then your homocysteine starts to rise in your blood. And homocysteine is inflammatory, and high levels of homocysteine are associated with an increased risk of Alzheimer's. So for example, this study found that a higher intake of B vitamins was associated with a 29% reduced risk of Alzheimer's. And again, just like with the vitamin D, you can't just willy-nilly take a bunch of B vitamins and expect that your homocysteine levels are going to go down, because there's certain genetic factors that prevent people from doing the whole methylation process properly, and you're going to take B vitamins and your homocysteine could still be elevated. So get your homocysteine levels checked. So the last supplement we're going to look at is huperzine A, and huperzine A is a natural cholinesterase inhibitor, just like the drugs, but this is natural. And it's shown a lot of promise in improving cognitive function in people with Alzheimer's disease. There's some meta-analysis that looked at randomized control trials that looked at huperzine A, and it does seem fairly promising. So now let's look at other relevant risk factors that don't have to do with lifestyle and don't have to do with diet or supplements. So in other words, an example would be traumatic brain injury, right? Like concussions. Now, traumatic brain injuries elicit a significant increased risk for developing Alzheimer's disease. This large systematic review found that traumatic brain injury was associated with a 30% increased risk of Alzheimer's. Now again, this is context dependent, right? Although this study I just mentioned showed a 30% increased risk of Alzheimer's with traumatic brain injury, another paper differentiated between early life and late life traumatic brain injury and found that traumatic brain injury later in life was not associated with a 30% increase in Alzheimer's disease, but rather a 200% increased risk. So it's all context dependent, right? How bad was your concussion? Did you lose consciousness? At what age did you have the concussion or the traumatic brain injury? What were the effects of the traumatic brain injury on your cognitive ability right away? These are all things that we have to take into account. So another risk factor in the other risk factor category would be cardiac arrhythmias, right? So the most common amongst them is AFib, or atrial fibrillation, right? Now, atrial fibrillation and other cardiac arrhythmias significantly increase your risk of Alzheimer's disease. It makes sense, right? If your heart isn't pumping in rhythm, then it's not going to get the blood distributed everywhere. It's not going to have the oxygen perfusion. You're going to have reduced blood flow to the brain, and then that results in cognitive decline. But similar to the traumatic brain injury aspects of things, age matters. So this systematic review looked at more than 300,000 subjects and found that those with AFib had a 40% increased risk of developing Alzheimer's. But this study looked at AFib that occurred later in life and found a 150% increased risk of Alzheimer's. Okay, so now let's move on to metabolic health. And poorly controlled blood sugar definitely increases your risk of developing Alzheimer's, right? So most people have heard of type 1 diabetes, they've heard of type 2 diabetes, but fewer people have ever heard of type 3 diabetes. And type 3 diabetes is a colloquial term for Alzheimer's. Some people call it diabetes of the brain. And that's because the relationship is so strong between uncontrolled blood sugar or high insulin levels and the development of Alzheimer's. Now, insulin resistance in the brain leads to altered or impaired glucose metabolism, which is a hallmark of Alzheimer's disease. But it's more than just that. Alzheimer's and type 2 diabetes share a lot of other things in common, including increased oxidative stress, mitochondrial dysfunction, advanced glycosylated end products, and studies have shown that insulin resistance can exacerbate amyloid plaques and tau protein pathology in these misfolded proteins, contributing to neurodegeneration. So I just want to highlight the point that I'm trying to get across here, and that's this whole like one-size-fits-all approach, or like one treatment with a univariate approach to treat whether it's Alzheimer's or Parkinson's or any form of cognitive decline. It just won't work very well. So when you're trying to prevent or manage Alzheimer's, you need to come at it from different angles, right? For example, the idea that you can treat Alzheimer's with one drug has completely failed, right? We're no closer to stopping or curing Alzheimer's than we were 40 years ago. However, I did find one paper that was really impressive. This was a paper done by researchers at Johns Hopkins, University of Maryland, and UCLA, where they took a multivariate approach, and not only did they see cognitive improvement, but they also saw hippocampal growth. So what did they do? Well, the subjects received personalized cognitive stimulation, neurofeedback training, brain coaching, and counseling for eating a Mediterranean diet, taking omega-3 fatty acid supplements, increasing fitness, practicing mindfulness meditation, and treatment for medical conditions. So if they had sleep apnea, they got treatment for sleep apnea. If they had depression, they got treatment for depression. If they had AFib or another cardiac arrhythmia, they got treatment for that. It was an individualized approach. Well, after a 12-week program, 84% of the patients experienced statistically significant improvements in their cognitive function. Now that's amazing in and of itself, but what's more amazing is that among a random sample of 17 patients who had a post-program quantitative MRI, 12 of those 17 patients had either no atrophy or actual growth above the baseline volume of their hippocampus. So if you're not familiar what the hippocampus is, it's basically the area of the brain that's involved in encoding memories, and it does other things too. Now, memory and executive function don't just take place in the hippocampus, they take place in other areas. But just the fact that they saw growth in the hippocampus, which is the main memory center of our brain, is insane. It's great. So again, just to reiterate, these were personalized programs, right? Hence the name of the paper. But it's just illustrative of the idea that there's no one treatment that should be like done on everybody. And it's like, in other words, like a one size fits all thing. But it also shouldn't be a singular treatment that's applied to anybody, right? Whether it's a drug or a diet or an exercise intervention. And so I want to highlight one paper just to finish this whole video off, just one paper that highlights the idea of what I'm trying to say. It says it the way I've been trying to say it, but it says it much more eloquently. So the quote from this paper, it says, "Physicians need to alternate between scientific principles and individualized care, two complementary systems of knowledge that reciprocate in a yin-yang manner. Scientific principles gained through research are collective in outlook, whereas the clinician's gaze is concentrated on the solitary patient." And this is the part that I love. "The capacity to switch between these two systems demands equal proficiency in the use of a telescope and a microscope." And that's what I love, is this quote about the telescope and the microscope, right? The telescope to look at the broad amount of research out there, but the microscope to be looking at the individual person in front of you with Alzheimer's who has individual needs. They have specific medical conditions that need individualized care, right? And so there isn't going to be one magic pill that's going to prevent Alzheimer's. There's not going to be one magic pill that's going to cure Alzheimer's, but taking a multifaceted approach would be the best way to go. So it's like building a fortress for your brain, right? The bigger the fortress, the more likely it is to be defended, right? So the layers of the fortress could be like sleep, exercise, diet, supplements, whatever it is that you as an individual need, right? So nobody can promise a cure. We can only slow down the progress of the condition and make sure that you're giving your brain the best shot it has for years to come. So don't wait until you're already in the game to start training. It's never too early to protect your most valuable asset, your mind, right? So start now. Keep your brain busy, keep your body moving, keep your lifestyle balanced. And remember, when it comes to Alzheimer's, the best defense is probably a good offense. Get out there, be proactive. So go out there, flex those brain muscles, or at least try to go out there if you can remember where you put your keys.